Before we start, let me tell you something that surprises many people over 60. The best time to walk for better health is often not when you have the most energy. It is not always first thing in the morning. And it is not only about getting more steps. For many older adults, the time you choose to walk can change how your body handles food, blood sugar, digestion, stiffness, sleep, and even how steady you feel on your feet. That is why this matters so much. If you have ever said, "I know walking is good for me, but when should I do it?" this may be the answer you have been looking for. I hear this question all the time. Some people feel tired after breakfast. Some get stiff after sitting through lunch. Some feel heavy and sluggish after dinner. Others wake up feeling sore and slow, and they wonder if a morning walk is the best choice. The truth is, there is not one perfect walking time for every person. But there is one time that stands out for many people over 60 because it fits real life and may give a very useful health boost. And when you understand why, it can make walking feel less confusing and much more rewarding. So here is the simple answer. For many adults over 60, one of the best times to walk is about 10 to 30 minutes after a meal, especially after your biggest meal of the day. That might be lunch for some people. For many others, it is dinner. The walk does not need to be long. It does not need to be fast. A gentle walk for 10 to 15 minutes can be enough to help your body in a meaningful way. This is one of those small habits that sounds almost too simple, yet it can support blood sugar, digestion, energy, and daily comfort in a very practical way. And here is the part many people miss. You do not need to wait until you feel motivated. You do not need fancy shoes, a fitness watch, or a perfect schedule. You just need a small window in your day when you can stand up and move a little after eating. If this topic speaks to you, tell me in the comments how old you are and when you usually walk. I read those comments, and they help me choose what to cover next. And if you want simple health guidance in plain English, please subscribe and share this with someone you love, because one gentle habit at the right time can make a day feel very different. Now let's make this easy to understand. After you eat, your blood sugar rises. That is normal. Your body then works to move that sugar out of your blood and into your cells, where it can be used for energy. When you walk after a meal, your muscles start using some of that sugar. That can help keep the rise from getting too high or lasting too long. In simple words, your body gets some extra help at the exact moment it needs it. That is one reason a short walk after eating can feel so good, especially if you often get sleepy, foggy, or sluggish after meals. This matters even more after 60 because the body often changes with age. Muscles may not respond as quickly as they once did. Some people become more sensitive to big meals. Some notice they feel shaky, sleepy, or drained after eating. Others are living with prediabetes, type 2 diabetes, high blood pressure, extra weight around the middle, or less physical activity than they had years ago. None of this means something is wrong with you as a person. It simply means timing your movement wisely may support your body better than random exercise squeezed in whenever you feel guilty about not doing enough. I want to pause here and say something important. A walk after a meal is not a cure. It is not a replacement for medical care. And it is not a reason to change medication on your own. If you take insulin, diabetes medicine, blood pressure medicine, or medicine that can make you feel dizzy, talk with your doctor or pharmacist about what kind of walking routine is safest for you. The goal is support, not risk. If you have chest pain, fainting, severe shortness of breath, new confusion, sudden weakness, or signs of a stroke, that is not a walking problem to figure out at home. That is a reason to get urgent medical help right away. Now, let's talk about the biggest question I know some of you are asking. If walking after meals is so helpful, Does that mean morning walks are not the best time anymore? Not at all. Morning walks can be wonderful, especially for people who wake up stiff, feel slow getting started, or have trouble sleeping at night. Morning light helps your body clock. It helps remind your brain that the day has started. That can support better sleep later on. Morning walking can also lift mood, reduce that heavy feeling that sometimes comes with poor sleep, and help you feel more in control of the day before the day starts controlling you. So if your main goal is better sleep, less stiffness, and a calm start, morning may be your best time. But if your main goal is smoother blood sugar, less fatigue after meals, and less evening sitting, then walking after a meal may have the edge. You do not have to choose one forever. Some people do best with a gentle morning walk a few days a week and a short post-dinner walk on other days. The best walking plan is the one you can keep doing without feeling punished by it. There is another reason the after-meal walk is so powerful. It fits into daily life. That matters more than people think. A habit is much easier to keep when it is tied to something you already do every day. You eat. Then you walk. That simple link can be stronger than any promise you make to yourself about starting a better routine next Monday. When a walk becomes part of breakfast, lunch, or dinner, it stops being another task on your list. It becomes the next natural step. I think of a woman I once described in a teaching example, not a real patient story, but someone very much like many people I meet. She was in her late 60s. She kept telling herself she would walk every morning, but mornings were full of little delays. She slept later than she wanted, took her pills, answered a text, looked at the weather, and before she knew it, the plan was gone. But when she started taking a 12-minute walk after dinner, everything changed. She did not need to decide every day. She just followed the meal with a walk. Within weeks, she felt less bloated, less stuck, and more confident. The walk was small. The change felt big. Now this is important. The walk after eating should be gentle to moderate. This is not the time to push hard. You should be able to talk in short sentences while walking. If you are breathing so hard that you cannot speak, that is probably too much right after a meal. A steady pace works well. Think of it as helping your body, not testing it. A flat sidewalk, a quiet hallway, a driveway, a backyard path, or even walking laps inside the house can be enough. If weather is bad, indoor walking still counts. Your body does not care whether the steps happen near the kitchen table or on a beautiful trail. Let's talk about dinner for a moment, because this may be the most useful insight in the whole video. If you can only choose one walk each day, for many people over 60, the best one to protect is the walk after dinner. Why? Because dinner is often the biggest meal. It is also the meal most likely to be followed by a long stretch of sitting. People eat, sit in a chair, watch television, scroll on a phone, and then head to bed. That means the body is trying to handle a full meal during the least active part of the day. A short walk after dinner breaks that pattern. It may help with blood sugar, reduce that stuffed feeling, and stop the evening from turning into hours and hours of stillness. That evening walk can help in another way too. Many older adults say they feel restless at night, but tired all day. Sometimes part of the problem is that the body has too much sitting packed into the late afternoon and evening. A gentle walk after dinner may help release tension from the day. It can settle the body without overstimulating it, especially if the walk is calm and not too late. If you walk very hard close to bedtime, some people feel too alert afterward. But a relaxed post-dinner stroll can feel almost like a reset button. Now, if you live with diabetes or prediabetes, timing becomes even more important. Many people focus only on what they eat. Of course that matters. But what you do after you eat matters too. If you have a meal and then sit for a long time, blood sugar can stay higher than you want. A short walk may help lower that rise. This is not about fear. It is about giving yourself one more tool that is free, simple, and gentle. If you check your blood sugar at home, you may want to ask your healthcare team whether it makes sense to notice the difference between a day when you sit after a meal and a day when you take a short walk. Never change your medicine on your own, but do ask good questions. And here is something many people find encouraging. You do not need one long walk to get real benefit. A lot of older adults think, if I cannot do 30 minutes, why bother? Please do not fall into that trap. 10 minutes counts. 5 minutes counts. Even a couple of minutes of moving is better than staying planted in a chair every single time. Some movement is better than none. That idea matters because it removes shame. It opens the door. It lets you begin where you are instead of where you wish you were. Let's say you have knee pain. Or you get short of breath easily. Or your back tightens up if you move too quickly. That does not mean walking is off the table. It means your walking plan needs to match your body. Start smaller. Slow the pace. Choose a smoother surface. Wear the shoes that feel safest. Use the cane or walker if you need it. Walk with someone if that makes you feel more secure. If you have severe pain, new swelling, or pain that gets worse rather than better, it is smart to check in with your doctor or physical therapist. Walking should challenge you a little sometimes, but it should not feel like you are battling your own body every step of the way. I also want to talk about blood pressure, because many older adults worry about it, and for good reason. Walking over time can support heart health and help with blood pressure as part of a healthy routine. But here is the caution. Some people feel lightheaded when they stand up, especially if they are dehydrated or take certain medicines. If that sounds like you, stand up slowly after eating. Place one hand on a chair or counter if needed. Give your body a few seconds before you begin walking. If you often feel dizzy, faint, or unsteady, do not brush that off. Bring it up with your doctor. Sometimes it is related to medicine, hydration, blood pressure changes, or an inner ear issue. You deserve answers. This brings us to hydration, which sounds simple, but gets missed all the time. Some people avoid drinking enough because they do not want to run to the bathroom. Others simply forget. But being a little dry can make walking feel much harder. It can make you feel weak, tired, constipated, or dizzy. You do not need to force huge amounts of water, but it helps to be aware of your fluid intake, especially in hot weather or if you are taking medicines that affect fluid balance. If you have heart failure or kidney disease, follow your doctor's advice on fluids. The point is not to guess. The point is to know what is right for your body. Now let's clear up a common myth. Some people think the best walk is always the earliest walk. They say, if I do not walk first thing in the morning, it does not count. That is just not true. A walk at noon counts. A walk after lunch counts. A walk after dinner counts. The best time to walk is the time that helps your health and fits your life. Morning is not morally better. Evening is not lazy. Timing is a tool. Use the tool that works for you. There is also a hidden benefit to walking after meals that many people do not expect. It can help digestion feel more comfortable. Not for everyone, and not after a huge heavy meal if you are trying to move too quickly, but a calm walk may help you feel less bloated and less sluggish. Instead of sitting in one position and feeling the heaviness settle in, you give your body gentle movement. Many people say they feel lighter afterward. That does not mean walking cures digestive disease, but it can be one practical habit that makes ordinary meals sit better. What about walking before meals? That can be good too, especially if that is when you feel strongest. A walk before breakfast may help wake you up. A walk before lunch may break up a long stretch of sitting. A walk before dinner can help you unwind from the day. But if we are asking one very specific question, the best time to walk for better health after 60, especially for blood sugar and energy support, the after-meal walk deserves special attention because it helps at the moment when the body is processing food. Now here is a very practical trick that can make this habit much easier. Do not wait until after the meal to decide whether you will walk. Decide before you eat. This sounds small, but it matters. If you wait until after the meal, your brain will start bargaining. I'm too full. I'll do it later. Maybe tomorrow. But if the plan is already set, there is less room for delay. You can even make it automatic. Finish the meal, clear the plate, put on your shoes and go. No debate. Just a gentle routine. Another helpful trick is what I call the small loop. Instead of promising yourself a long route, create a short one you can always do. Maybe it is one trip around the block. Maybe it is 5 minutes down the hallway and back. Maybe it is to the mailbox, to the corner, or around the garden path. If you feel good, you can always do more. But the short loop removes the fear of a big commitment. This is especially helpful if you are getting back into walking after months or years of doing less. And please do not underestimate the power of walking with another person. A spouse, a neighbor, a friend, an adult child, even a grandchild can change the feel of the habit. It becomes less like exercise and more like a shared part of the day. If you live alone, a phone call during a short indoor walk can also help, as long as you stay aware of where you are stepping. The point is not just movement. It is building a life that makes movement easier to repeat. I also want to say something for caregivers, because many of you are watching for someone you love. If your parent or partner resists exercise, try changing the wording. Instead of asking them to work out, ask them to take a few gentle steps after dinner. Those feel like very different requests. One sounds hard. The other sounds possible. Tie it to routine, not pressure. Offer company, not correction. For many older adults, feeling rushed or judged shuts the whole thing down. Feeling respected opens the door. Now, what if walking after meals makes you feel worse? That is important to notice. If you feel chest pressure, unusual shortness of breath, marked dizziness, severe leg pain, or you simply feel unwell in a new way, stop and get medical advice. If you have severe pain in one calf with swelling, or sudden shortness of breath, that needs prompt medical attention. If you have numbness, sudden weakness on one side, face drooping, or trouble speaking, call emergency services right away. Most people will not experience those problems, but I never want you to ignore serious warning signs. For everyone else, I want you to pay attention to the subtle signals too. Notice whether you feel less sleepy after meals. Notice whether your stomach feels calmer. Notice whether your evening feels less heavy. Notice whether you sleep a little better when you move after dinner instead of sitting the rest of the night. Notice whether your mind feels clearer. These are not dramatic movie moments. They are quiet signs that a simple habit may be supporting your body. And here is one more point many people overlook. Walking is not only about the body. It helps protect independence. That is one of the deepest concerns people have after 60, even if they do not always say it out loud. They want to keep driving, shopping, visiting family, doing their own errands, getting up from a chair without fear, and living their own life as fully as possible. Regular walking supports strength, balance, confidence, and endurance. It helps keep daily life open. That is why this habit matters so much. Not because it is trendy, Because it supports freedom. If you are wondering how much walking older adults should aim for overall, many health groups suggest working toward about 150 minutes of moderate activity each week, along with strength and balance work. But please do not let that number scare you. It is a goal, not a reason to give up. You can build toward it in small pieces. 10 minutes after meals adds up. Short walks count. Daily consistency often matters more than heroic effort once in a while. And if you have chronic illness, pain, or limited mobility, your safest plan may need to be adjusted with your doctor or physical therapist. I promised you one especially practical insight, so here it is. If you want the easiest way to know whether your walking pace is right after a meal, use the talk test. You should be able to speak in a comfortable voice, though maybe not sing. If you can talk, the pace is likely gentle enough for most people. If you are gasping, slow down. If you feel no movement at all and you want a little more challenge, pick up the pace slightly. This simple check can help you avoid the two big mistakes people make after meals: going too hard or doing nothing at all. So when is the best time to walk if you are over 60? For many people, the smartest answer is this. Walk after the meal that tends to leave you feeling the worst. If dinner leaves you heavy and inactive, walk after dinner. If lunch makes you sleepy and foggy, walk after lunch. If mornings are your stiffest time, protect a morning walk too. Let your real life guide you. That is how healthy habits actually last. If all of this still feels like too much, let me make it even smaller. Start tomorrow with one promise. After one meal, just one, stand up and walk for 5 minutes. That is all. You do not need to fix your whole life. You do not need to become a different person. You only need to begin. Then do it again the next day if it feels right. Tiny habits become routines. Routines become strength. Strength becomes confidence. I truly believe many people over 60 are trying very hard, but they are often given advice that feels too big, too vague, or too late. This habit is different. It is simple. It is kind to the body. It respects where you are now. And it can be adjusted for almost any level. That is why I love it. Not because it is flashy, but because it is real. So tonight, after your meal, do not rush to the couch. Stand up slowly. Let your body settle. Put on your shoes if you need them. Walk around the house, down the driveway, along the sidewalk, or anywhere safe. Take a few gentle minutes for yourself. Let your body do what it was made to do. And then notice how you feel. If this gave you clarity, tell me in the comments whether your best walk will be after breakfast, after lunch, or after dinner. I would love to know. And if there is someone in your life who wants to stay steady, strong, and independent after 60, please share this with them. Sometimes the most powerful health advice is not a big secret. It is one small step taken at the right time, again and again, with care.